Okay, so now I'm going to show our anesthesia and sedation records that are with every single anesthetic procedure we do. This is kind of everything in a nutshell, but I'll go over each part. So the first part is the date and the procedure, and then the rest of this through here is all signalment. So age, whether they are intact or have been spayed or castrated, weight in pounds as well as kilograms, and then their name and our clinic ID number. This right here is your pre-anesthetic vitals. So that's temperature, pulse, respiration, and then we always do the time that we did it. This right here is where I save for the doctor's pre-surgical exam. They kind of look over the pet, every single system to make sure that they are low risk and healthy to be able to undergo the procedure. This, we put the time that they last ate. The ASS grade of this particular patient is very low risk. It was a routine castration, and it was an ASA1. This is where I kind of write my notes of any physical assessment findings. We microchip everybody that comes in for surgery and for their wellness exams, and just write the location. That way if they ever migrate, we can find them. For this particular procedure, castration, I always check, make sure both testicles are descended, and then we always check baby teeth when they are young, over 6 months of age, to see if they're retained, because most of the time, if they haven't fallen out by 6 months, it may take a while. So usually we recommend just go ahead and getting them out while they're under anesthesia, instead of having to do it at a later time. This particular owner chose for the pre-anesthetic blood work, so that's marked off. And we always run a PCV and total solids on everybody. We do need to write that the doctor did look at it. These are our drug protocols, calculations. So this is our pre-op protocol, and then the calculation of the drugs, how it was administered, the time, and the initials of who administered it. This is our induction agents. Again, calculations of each, the way that it was administered, the time, and the initials. And most of these are our post-op or to-go-home meds. Most post-op and to-go-home meds through here. Down here, we always wrote if they chose the IV catheter, which this owner did, the size and where it was placed. We do the quality of the sedation, the fluid rate that we start out at. This is the size of the tube that we use. And then right here is all the equipment and monitoring systems that we employ during the procedure. And these are our emergency drug doses that we have ready to go in case there were any complications. The back of this page is where we actually do all of our charting and monitoring. We repeat the date, the client identification, the weight in kilograms, who was monitoring, the doctor who did the procedure, procedure start and end times, anesthesia and start and end times, fluid rate, we mark here. If it were to ever change, then we can just mark off that it increased or decreased. Temperature, these are all our monitoring parameters, and here is our key. We always make sure we note which type of gas we use, and then if we're using a non-invasive or invasive blood pressure system, we don't ever really place any arterial blood pressures, so they're always the non-invasive. We use the cuff with our monitoring machine with the Cardell. And then we always put which type of system we used. This one was a rebreathing. Most of our post-op, you have the option to put it here. Sometimes we put it on the travel sheet as well. So that's our anesthesia and sedation form. Post-op instructions. So we have kind of a generalized form that we used, and we can kind of pick and choose based on the procedure what we mark off. So there it is, kind of all together. But I'll show you one marked off. So for this procedure, it was a castration. So we have the patient, the client's name, which is usually, we put the last name, the patient name, the date they were admitted, and the date that they were released, the procedure that was performed. The first thing that we go over is medications. We always go over what medications we dispensed and when they should start them. Most of our routine procedures, most of them, this one in particular got carprofen, so we won't start. He got an injectable version today, so they wouldn't start the carprofene to go home until the next morning. Food and water restrictions, we always advise small amounts of food and water night after the procedure, just because the anesthetics can cause some vomiting issues, some motility issues. So we just tell them to do a small amount of meals tonight and then go back to their normal meal sizes the next morning. And water does not have to be withheld. This one he did because he had the deciduous teeth. We just put soft food for about 5 days just for those thick teeth. He probably could have only done 3, but just to be on the safe side. Exercise restrictions with any procedure, we put those there. If it were an orthopedic, it would definitely be very strict exercise restrictions. This one was just a castration. We still want them to be a strict leash walked only for 10 to 14 days post-op, just to try to prevent any like scrotal swelling, anything like that. If it was a more, if it was a more complicated procedure or like an orthopedic, then it would have different exercise restrictions, probably a little more strict than that. Sutures, so we always write what kind of sutures we put in, whether they need to come back for suture removal. These, on most routine castration spays, we do absorbable sutures, so they do not have to come back. But you definitely want to let your clients know that. You don't want them showing up thinking that there's sutures to be taken out, and really they didn't have to make the trip out there at all. So we definitely mark off that. And then any follow-up instructions or visits. If there were any abnormalities in the blood, so if there was an elevated blood value like an ALT or BUN, that maybe we okayed the surgical procedure, but maybe we just want to recheck it in 2 weeks, we would put that here. Or if there's a check any extraction sites, check incision, if there was a drain placed, we would want them back in 3 days. So this is where you can put all your information on when they may need to return sooner or later, just depending on the procedure that was done. Down here, we always put our phone number to have right in front of them if they do suspect any complications, and these are any complications that they should look out for. We definitely advise them of any swelling, redness, foul odors, any changes in behavior, not eating, things like that, to give us a call. Some things might be pain related where they can give us a call and just pick up a medication. Other things, if it's swelling, we would want to see the incision site and have them come in and evaluate and see, is it just serous buildup from maybe too much activity, they weren't restricting very well, doing exercise restriction very well, or is it something a little more complicated? Does it need antibiotics or longer antibiotics or anything like that? This is a spot where we can put any additional things. We tend to put our e-collar usage there. If it's a declaw, we'll put, make sure to use paper, shredded paper, yesterday's newsletter. So anything that's real specific to the surgery and the case, we'll use to put right here. We always have the client sign that we went over everything with them. And then we generally sign right here to have whoever did the discharge instructions, so that if there was ever any questions as far as what was done, what was said, we can go back and look to see who did the discharge instructions.